Hello everybody. Today we'll be discussing yet another important topic in ICU, which is thrombocytopenia in ICU. So let us know what are platelets. Platelets are the smallest anucleate blood cells which are produced from the megakaryocytes in the bone marrow, lung, spleen and liver. So we all know, like, as erythropoietin is essential for the generation of or erythropoiesis or RBC production. Similarly, there is thrombopoietin, which is secreted mostly by the kidney and which is critical for thrombopoiesis. So the lifespan of platelets being 7 to 10 days in circulation, and they are sequestered by the splenic and liver macrophages. So the normal level of platelets, all of us will be aware of it, are around 1.5 to 4.5 lakhs, and thrombocytopenia being a platelet count of less than 1.5 lakh. They are further graded into mild, moderate and severe, with mild being around 1 to 1.5 lakhs, moderate 50,000 to 1 lakh, and severe thrombocytopenia is less than 50,000 at any instant of time. So the incidence of thrombocytopenia in ICU is very high. It is around 14 to 44%, and it is variable due to age, severity, illness, the ICU characteristics. Like in a medical ICU, the incidence of thrombocytopenia is much higher. In a surgical ICU, it is little less. In a cardiac ICU, there is a sudden fall in the platelet count immediately post-op, and then it surges again. So the incidence varies depending on the type of ICU you have been there. And as per the PROTECT trial, it's a very famous trial which was done for the incidence of thrombocytopenia as well as the anticoagulation which has to be used. And that says that the incidence of thrombocytopenia, mild, moderate and severe, is around 15, 5 and 1.6% respectively. So why are we so much worried about the thrombocytopenia? It's just low platelet count. So several studies have shown that thrombocytopenia is an direct predictor of mortality. That is, the more severe the grade of thrombocytopenia, the mortality is high. Or it has been even shown that in non-survivors, the thrombocytopenia duration has been for a very longer time. In addition to the predictor of mortality, it is also a predictor of morbidity. It is even a predictor of the underlying organ function. There are studies which have shown that thrombocytopenia directly correlates with SOFA score, and as we recollect, thrombocytopenia or platelet count is also one of the variable inside SOFA score, or in some instances it is just insignificant. So pathogenesis of thrombocytopenia. There are various causes wherein there can be a low platelet count in an ICU. So in summary, we can see that it is either due to the artificial causes, we'll go in details later, or decreased production of the platelets, increased consumption of the platelets, increased destruction of the platelets, which can be either immunological destruction or non-immunological destruction, or increased sequestration of the platelets. So let us go each one in detail. Artificial causes. The artificial causes are usually termed as pseudothrombocytopenia. So this pseudothrombocytopenia implies there are giant platelet clumps which have been formed. So these platelet clumps are formed either because of the presence of EDTA, that is the EDTA antibodies which form in the circulation, or it can be even secondary to the usage of drugs like GP2B inhibitors like eptifibatide, tirofiban or apixaban. It is even because of the hemodilution, like in a patient with major trauma or in a patient with hypovolemic shock, wherein you have to transfuse lot of blood products. The hemodilution also sometimes causes this pseudothrombocytopenia. In some instances, it is also because of inadequate anticoagulant present in the test tube which has been taken for the testing, or indirectly you can say that because of the EDTA antibodies. So in these pseudothrombocytopenia, usually we confirm this low platelet count by again a manual checking. Like for instance, many a times we must have experienced it in the ICU that there is a lab personnel which is calling and saying that the platelet counts are low. So we are reconfirming it. That is because the platelet clumps, as we can see here, the platelet clumps or the giant platelets which get formed are not counted as separate individual platelets by the automated machine automator. So that is why we further go into a manual count wherein we have a doubt regarding it. Next is a decreased production. So as we saw, platelets are being produced in the bone marrow, liver, spleen, and because of the thrombopoietin secreted by the kidney. So we can now know that decreased production is definitely because of the some bone marrow infiltration or bone marrow diseases in terms of any cancers or leukemias, or it can be post chemotherapy or radiotherapy where there is bone marrow suppression because of the drugs or chemicals or certain antibiotics which cause bone marrow suppression, because of the acute alcohol intoxicity, various viral infections, as we know the most common being dengue infection or the chikungunya virus, many other viruses, even the COVID virus, we had seen that there was some amount of thrombocytopenia. So various viral infection can cause bone marrow suppression, decreased production or decreased thrombopoietin production because of the kidney diseases. Third is increased consumption. So increased consumption indirectly means there is loss. So that is why there is too much of platelets being consumed, like we can see in DIC where there is altered coagulation parameters and initially you have lot of clotting form, then bleeding disorder. So inadequate clotting factors and increased consumption of the platelets. It is also seen in sepsis, we'll go about it in detail later, wherein platelets are being utilized for multiple purposes. Usage of extracorporeal circuits, for instance in post-cardiac surgery, wherein patient goes on pump and then comes back. So there is platelet destruction which happens in the extracorporeal circuits, or in a patient who is placed on ECMO, in a patient on IABP, or in a patient with HD catheters. We always see that their platelet range is below normal, or in TTP like thrombotic thrombocytopenic purpura. In trauma, as we said, there is trauma induced coagulopathy and loss, or in simple blood loss.